This is Helen Latra, who came from the UK, London, and just have a few words about her disease, which is called CRPS, and she is suffering from the last almost 3 years.
Yes.
Okay, go ahead.
I'm 29 years old. I ended up with complex visual pain syndrome after a motor accident in 2009. So I've been suffering with the disease, like Mr. Idris says, just almost 3 years now. It affected my lower back, my lower right limb, a lot of motor dysfunction, so I was unable to move my toes, my foot, ankle, leg, and suffer with a great deal of chronic pain on a daily basis, which unfortunately current medication does not help. I'm here in Dublin with Dr. Idris to hope to improve my life, to get me off walking sticks, walking aids, get me back to work, and hopefully improve my quality of life. I had my first treatment yesterday, which lasted about 45 minutes. My pain scale, before I was attached to the scrambler machine, was about an 8. As soon as the electrodes were put on, probably about approximately 5 minutes after, I couldn't actually feel much pain in my back at all. I could start to wiggle my toes, and the pain relief, I would say, had gone down to about a 2 or 1, if that. When I left the pain clinic, the pain did return after about an hour and a half. However, with each treatment, this should increase, and this is a normal process.
Okay. What score you have today? This is your second day treatment.
I'd say about a 7 or an 8.
7 and 8, and it's the same like yesterday we started, or it's slightly less?
Slightly less.
Slightly less.
But it's still in the back.
Still in the back,
yes.
More. And what about your sole foot?
The foot, again, I'm getting intermittent pain, but I'd say it was a little bit less than yesterday.
Okay, very good. So we shortly start the treatment, okay?
Okay.
Thank you. Okay, Helen, now, yesterday we were checking that this side is very sensitive.
Yes.
Is it still sensitive?
Yes, at the moment.
And touching here, what do you feel?
Hypersensitivity, so it's not as bad as yesterday, but the more where the red marks are,
okay,
it's more sensitive.
Yeah. Okay, I will not touch that.
Okay, thank you.
And what about here? Yesterday it was fine.
That's
still
bearable,
okay.
that's comfortable, yeah.
So I just mark here. Sorry about that.
That's okay.
It's okay. There we placed our yesterday electrodes.
And
you still think your sole is very
on
sensitive?
the sole, on cold surfaces, it's very hypersensitive and uncomfortable.
Still?
Yes.
And is it the same as yesterday or less?
I would say pretty much the same still.
Okay.
Yeah.
And in your back, still very sore?
That's the same. That's where I have the allodynia. Yes.
Okay. So just here, you have in the back is allodynia.
Yes.
What you call is very hypersensitive.
It is, yes.
And touching just causes you pain.
Exactly.
Okay. That's